COVID hospitalizations are falling across the state, but here in the Panhandle region, the hospitalization rate is still at nearly 19%.
Tonight, KAMR Local 4's Kaylee Green finds out how regional and community hospitals are handling the Omicron surge as we bring you facts, not fear.
John Henderson, the president and CEO of the Texas Organization of Rural and Community Hospitals, says the Omicron surge is going down as quickly as it went up. But rural doctors and nurses are bearing the brunt.
And because Omicron patients weren't quite as sick, they actually stayed in the rural hospitals rather than being transferred to a higher level of care generally. So this most recent phase of the pandemic has probably been the hardest on some of our rural community hospitals in Texas.
CEO of the Smith County Hospital District, Jeff Barnhart, says their COVID numbers are stable and trending down.
We've still got ICU patients, but not the numbers. I know probably 6 weeks ago, our ICU was full and we probably had 8 or 10 on the floor that needed to be in our ICU and we had nowhere to send them. So we're certainly glad to be where we are today.
But he says more than half of their patients are still COVID patients, the majority unvaccinated. Meanwhile, the transfer process is improving.
It depends on what the problem is with the patient. COVID patients, sometimes they're still hard to get out, but we're having a little better success with other things such as cardiac and things like that. Being able to keep them local, Amarillo or Lubbock.
Dr. Brian Weiss, the chief medical officer at Northwest Texas Hospital, says on Monday they had 35 patients holding in area hospitals awaiting transfer.
I think there were 12 that were COVID patients, and 21 of those were critical care patients. So still not where we want to be in terms of being able to really bring in more patients from the region.
But Barnhart says regional hospitals are still faring better than smaller community hospitals right now.
We find that they're reaching out to us and everybody else to try to help them get that patient out of their hospital. And we certainly try to help where we can with that.
Now, statewide staffing remains an issue for healthcare providers, especially in those smaller community hospitals. Henderson says it will be a dominant issue in Texas for the next 5 to 10 years. Live in studio, Kaylee Green, KMR Local 4 News. Andy and Jackie.
Kaylee, thank you. Barnhart is still advocating for vaccinations and social distancing at this point in the Omicron surge, especially ahead of the Super Bowl.
He says they're continuing to see an increase in cases after large gatherings. Today,